Compared to the past, where Uganda had only one medical school under Makerere University at Mulago Hospital, several medical schools have since cropped up. Experts question the efficacy of the mushrooming the ill-planned, under-equipped training institutions. They suggest strict regulation of the medical schools.
We feel that not anybody should gamble with training doctors. Just because somebody has got money and they think that they can start a medical school, it's not fair to the profession. So we want that section to be ring-fenced.
While appearing before the Education Policy Review Commission, the chairperson of the council, Professor Joel Okullo, said some medical training institutions are admitting students who do not have the required academic standards.
The National Council for Education says 2 principal passes in, I think, chemistry and biology. We have gone to a number of schools where we find somebody with an O in biology and is doing medicine. How? You know, when the foundation is poor, you can never be able to improve.
According to the council, there is need for physical pre-admission interviews to ensure that aspiring medical professionals possess not only the necessary academic qualifications, but also the compassion and attitude vital for medical practice.
One of the biggest problems we are having in the medical profession is attitude. When we talk about compassion, that's attitude. No wonder when a number of them come out, they're charging the kind of fees that you're talking about. 150,000 consultations fee. Before I operate, I want you to pay money. And so on and so forth. You have heard about that.
The council has also called for joint national examinations in medical education to evaluate whether students are being taught according to the prescribed curriculum.
What we have developed in this country and in the East African region is what we call co-curriculum. And this is what is available to all the medical schools. Are they adhering to it? Yes and no. When you finish the training in the curriculum, you give an exam. That exam is given by the university according to what they have taught. If they have just taught half of it, they'll give that exam half. And then you'll find students with flying colors. And then they want to apply for scholarships and so on and so forth. But you are not sure of the product. And that is why we are suggesting that all the medical graduates must do a national exam.
The Uganda Medical, Dental and Practitioners Council says Uganda's long-cherished health professionals' reputation internationally risks getting eroded or dented.
Something in the media about the Kenya Medical Council stopping internship for foreign trained doctors. Now that was a very gentle way of taking care of the Uganda situation. Just because of one school, so many other graduates in medicine in Uganda cannot now go across and do internship in Kenya and practice.
In a related development, the council called for the creation of a special health tribunal to resolve cases related to health professional training, standards and competence.
So we have got a group of doctors whom we feel were not adequately prepared for the public, but the court ordered us to release them. I'm saying this so that you can be aware of what may be out there.
The Education Policy Review Commission is collecting views from different stakeholders to guide it evaluate and examine various aspects of the education sector. Nobat Atkunda, NTV News.